Good morning. Welcome to another episode of I
Wonder.
Wednesday. Today, we're going to talk about pink eye. And for most people, there's only one type of pink eye. We're here to kind of break that myth. There are many types of pink eye. So what's the one that you run into the most, do you think?
So I would say the most common pink eye that we run into is due to a virus, which we see in kids and swimming pool exposure. So that is when a kid has a cold, or an adult. Adults can get it too, but kids are usually the vector or the starting point. When kids get a cold, oftentimes they'll rub their nose and then they'll rub their eyes, which sounds disgusting, but that's exactly how you get it. And so that is caused by a virus. And for those of you who pay attention or listen to the fact of us trying to reduce antibiotic resistance, when a patient has a virus, an antibiotic doesn't work, which is not always the most fun thing to tell a parent. Hey, by the way, this is a virus. There's not an antibiotic I can prescribe. There are many things we can do to make the child more comfortable and to help the virus pass a little more easily or quickly, but antibiotics are not the treatment for that. So when a kid gets a red, sticky, gooey eye, give us a call. We'd love to see them. We have the unique ability to look at an eye under a microscope, whereas the primary care doctor or the pediatrician doesn't have the equipment. And so what we see when we look in the microscope does help us determine whether it's a virus or whether it is bacterial. But I would say viruses are the number one cause of pink eye that we see in the office.
Yeah, I would kind of add to that with the viral pink eye, which is super common when school starts back up in the fall, when school starts back up right after Christmas break, we see a lot of it, and it's very, very contagious. Oh, yeah. So if you touch it and then touch somebody else's hand and then they touch their eye, guess what? You've just passed on that virus, and it's going to kind of make the rounds. A lot of times we see that patients will call us, 3 or 4 days. My son or daughter has been on this medication for 3 or 4 days. It's not helping. In fact, it might be getting worse. We went to the pediatrician, and the pediatrician is terrific. They're great, but they just don't have the tools to determine whether it's bacterial or viral or fungal, what's causing that. So a lot of times they'll prescribe a really broad antibiotic that covers a lot of bacteria, but it doesn't fix the virus. And so then we get the patient and send over another prescription or do an in-office treatment. We can do betadine treatments in office that are actually antiviral. They're not pleasant.
My husband will tell you that he can't believe I have patients come back for that. I did that to him one time when he had a horrible viral conjunctivitis, and he thought I was not nice.
So the medication, the betadine, is actually very toxic to the eye's surface as well. So it causes an increase in sensitivity and pain for about 24 hours, but it kills the virus that's there and prevents it from replicating. And so you end up clearing the virus very, very quickly. There are also prescription eye drops that we can prescribe. They're incredibly expensive, $200 or $300, but they have been shown to clear up those viral pink eyes very, very quickly as well. I had a patient had a wedding 3 days from now, and they've got a viral conjunctivitis. Well, that's going to take 10 days to clear up. Guess what? She was willing to sacrifice and get that prescription drop, and she looked great in her wedding photos.
Yeah. That does happen, unfortunately.
So bacterial pink eye, like where and when do you see that most often?
Most often it's with contact lens wearers, to be fair. When you're taking your hand and putting a contact lens on it and putting it in your eye, and you don't wash your hands, or you touch something after you've washed your hands, that's typically where we see those bacterial infections. And they are very strong, and they create a lot more mucus and a lot more pain and irritation. And so they do need to be treated, and they need to be treated with a correct antibiotic. And so again, that's why we look, because different antibiotics treat different types of bacteria.
Yeah. And when we look, that eye is usually really light sensitive as well. So the first question we ask with any pink eye, do you wear contact lenses? Because that by itself will tell us a lot about what we might be looking for. There are also things like funguses that, if you scratch your eye with a tree branch while you're out in the yard or you're weed eating or something like that, you can get a fungal infection. And those are probably the most difficult to treat. They kind of start out slow, smolder for a while, and they're just a little irritated. And then when they really take off, they've already ingrained themselves really deeply in the tissue. So we have to know what is causing the pink eye, whether it's a virus or a bacteria or a fungus, and then we can, again, target that treatment to fix the problem.
Yeah. I would say that contact lens wearers we tell them, wash your hands, but there is a reason for it. It doesn't happen it's not like every single contact lens patient gets an infection, but if they do get an infection, it's typically a little bit worse than those who have never worn contacts because of the bacteria that's been introduced.
Yeah, and even scratching their eye when they're taking the lenses out at night, maybe they're really tired and they're not paying attention and didn't do a good job of washing their hands before they grab that lens. So those are kind of the underlying reasons. But if we know what caused the pink eye and we can target that treatment, then we will get you better. So
yeah.
Thanks again for watching another episode of I Wonder Wednesday. Go ahead and
follow us and subscribe on Instagram, YouTube, and Facebook. Not necessarily in that order.
Thanks, yeah.